Great. So hopefully you'll all be aware that today's workshop is on supporting students who self-harm. So it's an hour, so we're hoping to be finished by 3 o'clock today. And we aren't able to kind of see or hear you right now, but we do have Q&A throughout, so you should, through Zoom, be able to use the Q&A function, which will make sure we attend to that by the end. We also use something called Slido, which I'll explain as we go through. So Slido is something that you may have used before. It's a free interactive tool. So you just go to slido.com. You don't have to create an account. You just put the event code in for today. And it allows us to be able to ask some questions and you can respond to us and we'll see it come up on the screen. You don't need to put your name in, so it remains anonymous, but it's really helpful for us just to kind of gauge who's there and to get some feedback from yourselves on certain things and just to kind of help you get thinking a little bit. So I would encourage everybody as an individual, whether you're in a group watching this or not, to log on to Slido. It's easiest normally just to do it on your phone or a separate device to what you're watching it on. So if you just go to slido.com, the event code is 1558346. That code will come up every time a Slido question comes up, so you don't need to remember it. So I'll just give people a few moments just to kind of log on to Slido. Great, I can see a few people are. So the first question is just, what is your role in school? It's helpful for us again because we don't know you, we can't see you right now, just to think about the staff makeup really. And anyone from schools have been invited. So I expect lots of different roles. So we've got some teachers, teaching assistants, deputy head, specialist teacher for SEMH school, great, inclusion TA, head of year, safeguarding team, local authority worker. Great, it's really lovely to see such a range of people here today, head of year, and a few people logging on to Slido, which is great. Oh, it looks like a few people from this one. Deputy Head, Senko, Send Administration, TAs in Send School. Lovely, thank you. I don't know if we'd have ever met before, but yeah, welcome everyone that's here. That's great. Okay, so it looks like Slido is working okay. So just also for us to bear in mind as we go through this, what age students do you work with? Because we're aware that there may be some people from primary school settings, high school settings, or colleges. 11 to 16, primary age, 4 to 16, secondary. Okay, 11 to 20, 11 to 18. So quite a big range here today, really, from 4 to 20, it seems like. Okay, that's really useful for us to kind of bear in mind. This workshop isn't aimed at a really specific age group. It could apply to the whole range, but we may just kind of need to think about adaptations of how to think about it and how to use it with a different kind of age range. Okay. So one last Slido question before we start, and we'll ask this one at the end as well. How would you rate your confidence in effectively supporting young people who self-harm? So one would be not feeling confident at all. Kind of the other scale would be totally confident, and all of those in between. It's got mixed at the moment. No one's put kind of not confident at all or totally confident, but we've got a little bit, somewhat, and pretty confident. Okay, I guess that's what we would expect, and we know that there'll be lots of people with kind of lots of experience in this area, some knowledge, but actually some people feeling a bit less confident or not sure how to use some of it. So that's kind of what we would expect. So what we're going to cover today is a little bit around self-harm and why may people self-harm, and that bit is really kind of crucial to how we support them. So we'll be encouraging you to think about the function that self-harm may be serving for a young person. We'll look at some helpful coping strategies and things you can think about in terms of supporting your students. We do have some additional resources and kind of signposting towards the end as well for you to look at things. We do only have that hour, slightly less than an hour now. So it is kind of a bit of a brief touching base of self-harm, what it is and what we can do to support it. So absolutely, you may be interested to kind of read some further resources or look into some of the things that we're going to show you. And what's really important to say is that there will be individual differences that exist. So there's not kind of a one size fits all approach when it comes to self-harm. Each person is individual. We know today there's people representing schools of all different age groups, and someone's age also makes a difference. So what we really aim to do is to help you think a little bit more about self-harm, and to think about ways we can help provide a helpful environment which will lessen the risk. But it may be that what works for one person doesn't quite work for someone else. So we're just kind of keeping that in mind, that ideally we just want to use a person-centered approach. And also ideally we want to lessen the risk, but we can't kind of completely get rid of that risk or take away risk. That's not fully in our control. So that's just something to hold in mind for yourself as well. So a bit more of a reflective question for you to begin with. How do you feel when you think of a child or young person self-harming? So you may have experienced talking to a young person who's self-harmed before. You may not have experienced it. But even just kind of when we start to think about this topic, what are your kind of initial thoughts or feelings that come up for you? And of course, there's no kind of right or wrong way to feel with this. This is just an exercise to kind of get in touch with what it feels like to you when you think about a young person that may be self-harming. So this is a word cloud. So the more people that write a certain response, the bigger that word will become. So we've obviously got a few people that have said anxious, sad, concerned, worry. Yeah, and there may be a whole range of emotions that come up, and potentially mixed emotions, even in the same situation. You may be kind of feeling more than one thing. So you may be feeling quite anxious, or you may be feeling sad, or a bit of both. Sympathy, so we may be kind of really holding that person in mind. Melancholic, yeah, nice word. Fear, worry. So absolutely, these emotions are completely understandable, and I think it would kind of be unusual for them not to pop up when we think about self-harm. Even if you're someone that's quite experienced in talking about it with a young person, it still can bring up some of these emotions. And you can see that amongst everyone here today, there's some common things that people are feeling, like feeling anxious and feeling concerned about it. So it's quite helpful to keep this model in mind when we think about working with self-harm, that looks at the different mind states. So if you look at this blue circle, that refers to the emotional mind state. So that emotional mind state is those kind of feelings that we experience. So when we're in an emotional mind state, we're very responsive to those immediate feelings. So our thoughts and behaviors are very much directed by the feelings. So whether that's feeling sad or anxious or angry. And actually, it's really important to be aware of our feelings and to sometimes react quite quickly to our feelings. So, for example, if we're about to cross the road and a car's coming our way, we experience that fear and it makes us step away. So we're kind of in that emotional mind state, and it can be helpful. But there is an unhelpful side to that as well. So sometimes in that emotional mind state, we may do or say things that are kind of quite impulsive, or we're not always able to hold in mind the consequences. And so when thinking about self-harm, it may be that you kind of jump right into that emotional mind state. So we know that there are those emotions there, and it may be that you're kind of very much led and directed by some of those emotions, like fear or sadness, in terms of how you respond and what you do. But there's also this reasonable mind state. Again, it's something that we kind of all possess. So this is based on logic, really. So it's when we're in that reasonable mind state, we're kind of making decisions and working them out very logically, thinking about the research and the facts. Again, also really useful, and we need this mind state in kind of our everyday life to make decisions. And for some people, when they're responding to something like self-harm, actually, they may go into that more kind of logic, fact-based, more practical mind state. But the green bit, which is the emotional mind and reasonable mind coming together, is that kind of slightly more balanced mind state. So it's still drawing upon those emotions and using them to direct us a little bit, or to direct us in making decisions. But actually, the reasonable mind is still there as well and informing what we do. So it's the two coming together, and which is what is described as the wise mind. And when we're in this wise mind state, we can think through things, but we can kind of use our intuition, and we have a bit more of a balanced thinking. So we're kind of responding and using the emotions, but also thinking about the facts and the knowledge of the situation. So again, thinking back to how this is relevant when working with students who may be self-harming, it's helpful to think about what one you naturally fall into, because although we all possess them, we may kind of naturally gravitate towards one. And really, we kind of want to be able to work towards getting into more of that wise mind state when we're responding, so that we can use those feelings, those human feelings that we have, and that kind of helps us be compassionate. But we can also kind of draw upon the information that we're being presented with and kind of think through some things. But just being kind of aware of what state you're naturally pulled into can be helpful, and then we can have more capacity to make a decision about what area to move into. So as we go through the presentation today, do just kind of hold in mind those different mind states, and kind of what you feel more familiar with, or what you feel is more helpful. And so on that note, when we're thinking about us as being humans ourselves who have natural emotions and respond to self-harm in certain ways, it's really important to make sure that you're thinking about yourself and looking after yourself. Even just today in this presentation, it may evoke some strong emotions. So thinking about how you kind of take care of yourself. And you've probably heard it all before, but in order to support other people, we do need to support ourselves first. So as they say on an aeroplane, with the oxygen mask, you put your own oxygen mask on before supporting someone else, including children, to put theirs on. And that's because if we kind of can't breathe and don't have oxygen, we're not going to be able to help anyone else. So we use that kind of an analogy when thinking about people's well-being, that actually no one can support a young person's well-being who's really distressed if we and ourselves are kind of emotionally dysregulated. So just thinking about what you do to support yourself when we're talking about these difficult issues, when you're working with a student where lots of emotions are coming up. So you can have a think about this yourself, whether it's doing things like just making sure you're taking regular breaks in what you're doing, connecting with others, so using your support system. So within your school, for example, who else is your support system, to check in on things, to have a bit of a tag team. And yeah, just essentially kind of being aware of your own boundaries and when it's too much for you, and who else you can get that support from. So we're going to move on to thinking more specifically about what is self-harm, particularly with young people. So we've got a definition of self-harm up on the screen from the National Self-Harm Network. It's slightly outdated, 2013. So self-harm is the act of deliberately causing harm to oneself, either by causing physical injury or by putting oneself in dangerous situations and or self-neglect. So it actually covers quite a few different things. It's quite encompassing. So it's not just that kind of deliberately hurting oneself, but actually putting yourself in dangerous situations, kind of deliberately or neglecting yourself. And on the right hand side of the screen, there's a few examples that you may be familiar with. So one of the ones that's kind of quite common and well known is cutting yourself, but it could be any one of those: scratching, hair pulling, burning, hitting self, head banging. Also things like poisoning, taking an overdose of medication, it can be considered self-harm. Some of these, such as an overdose, may also be something that people do in order to end their lives. Today, we are just specifically thinking about self-harm. So we're thinking about these things in relation to someone causing themselves injury or pain, rather than intentionally trying to end their life. But just to note, some of these could also be used for that as well. And in terms of the medication, I guess it's also helpful to bear in mind that it may be that someone has a health condition and they're prescribed a particular medication, and they're using that in some way to self-harm, for example, giving themselves more or not giving themselves enough of what they need. So there's lots of different kind of ways that someone could self-harm. And often that the self-harm method can change. So it's not like people necessarily stick to one thing or are using one method. So we've got some indicators of self-harm or self-interest behaviours. So these are just some of the things to look out for, which may possibly indicate that something's going on. But obviously they aren't kind of necessarily the only signs, and they don't always mean that someone's using self-harm. So it may be that people kind of are clearly trying to cover up their arms or legs in ways that would be unexpected, for example. You may just clearly notice some unexplained cuts, bruises, or burns, bald patches, or something like that. You may notice that they're carrying around sharp objects, which again, maybe you wouldn't expect them to be carrying around. You may notice kind of low, fluctuating mood or irritability, a student becoming quite withdrawn or isolated, low self-esteem. You may notice changes in things like eating or sleeping, or things like being able to attend school potentially, and potentially kind of drug or alcohol use. So these could all be indicators of numerous things. For example, there just been some kind of underlying mental health difficulty. But it's worth bearing in mind that they could also be indicators that someone could be using self-harm. So usually kind of multiple indications are greater cause for concern rather than one single in isolation. And it's quite helpful to hold in mind the person and whether their behaviour is different to normal. And as school staff, you actually probably know that student quite well and know if something feels quite different. As I said, just helpful to bear in mind, self-harm method can change, and I guess would be more concerned when the self-harm starts escalating as well. So it may start off with something that they do kind of once or infrequently, and if that's building or they're using more and more different things to self-harm, that would kind of give us a few more concerns. So these are things just, I guess, to be observing and to be thinking about if you're worried about someone potentially using self-harm. And we're just going to think about why people self-harm a little bit. And this question of why is really important, because if we can't make sense of the self-harm, there's a limited amount that we can do to help them. So there's lots of different reasons why people may use self-harm, and we're going to go on to those. But I guess it's just really important to state how making sense of that self-harm is the first step. It can be quite easy to go into that kind of quick fix mode of someone self-harming, let's kind of fix this straight away. But actually, if we don't know the kind of underlying causes, that quick fix may not quite work in the long term. So we really want to kind of properly understand the situation that someone's in, and how we can support them. So why do young people hurt themselves intentionally? And if we've never experienced that ourselves, it can sometimes be quite a challenging question to ask. And, lots of parents will also kind of wonder this. But essentially, self-harm can often be seen as a solution to how the child feels in that moment. So they are usually using it for a reason, and there is most of the time some kind of distress underlying it. So self-harm can become a stable way of managing or escaping painful emotions. And we know that children are kind of still learning about their emotions. So they have these big emotions, but they don't always have all of the skills or knowledge of what to do with those big emotions. We know that brain is still developing until they reach the age of 25. So even, someone that's 18 and cognitively doing very well, they may be kind of very independent, actually they're still learning and kind of sifting through and sorting their emotions and learning how to manage them. So self-harm may be for some young people a solution to kind of working with their feelings in the moment. And although for some people it can feel like a helpful thing to do in the short term, most people who self-harm do say that actually in the long term it's not so helpful. And we often see this. So when people use self-harm, actually over time it can sometimes make them feel worse. It kind of brings up feelings of guilt or increases that sense of sadness or anxiety. So people do it because in the short term it can make people feel better, but in the long term actually it doesn't, and it's also not kind of viable as a long-term coping strategy for them either. So thinking about some underlying issues that can lead to self-harm, and we've got quite a few on this screen, and this is just kind of bearing in mind all those different things. So relationships and bullying are some of the key ones, and ones that you may notice within a school setting as well. So sometimes people will have relationship breakdowns, whether that's with family, friends, a romantic partner. It may be that they've experienced some kind of bullying, physical or verbal. And that can sometimes be a trigger or an underlying issue for people, which can lead to self-harm. It may be that they're experiencing some underlying mental health difficulties, whether that's around self-esteem, low mood, or worries, and self-harm is a way to manage some of those mental health difficulties. It's also useful to consider things in their background, such as if there's any abuse happening. We know that those that have been abused in any sort of way, emotionally, physically, sexually, are more likely to experience self-harm. And also thinking about anything else that's happening in their wider context. So have they experienced any kind of grief or loss? So that may be a bereavement. It may be kind of grief or loss in another way, for example, a big change, going to a new school, grief in terms of a relationship breakdown. We also know that illness and disability can be a background factor that makes people more likely to use self-harm. So, for example, neurodiversity, that's kind of a factor associated with self-harm as well. Also really important to think about drug and alcohol misuse. So that is also considered often considered an underlying issue with self-harm. So people who use drugs or alcohol are more likely to self-harm, and they could self-harm when they're under the influence, which can make it more risky as well. So if we are aware of self-harm, it's always really important to check out if there's any drug or alcohol misuse. Also, an important factor is exposure to self-harm and suicide. So this may be exposure within their kind of daily life, within their peer network, or it could be online. So we know that people have really been affected by things that they've seen online. There's been a lot more news and media coverage about this recently. Unfortunately, young people are still able to access forums and images of people using self-harm, for example, which may be a bit of a trigger in itself. We also know that sometimes within schools, self-harm kind of seems to increase among people at the same time. Sometimes there can be peer influence, but what's important to say with that is it's very rarely the case that someone's using self-harm just because their peer is. It's more likely the case that whoever's using self-harm, they've got some underlying distress, but if they know that there's peers, for example, that are using self-harm, it kind of makes it more of a viable coping strategy for them. So that's why sometimes it can seem to appear like it's happening in peer groups. But that's not to kind of underestimate the distress that each person is experiencing within that. And if self-harm or suicidal thinking is occurring within a peer group, it's still important to kind of address it individually, so to kind of talk to people on an individual basis. So these are just kind of factors that are associated with self-harm and some underlying issues which may be kind of a factor within it. And we're thinking at the moment about understanding that self-harm, and when we've kind of looked at what is happening in a child's life and any kind of underlying issues, it's helpful to think about, is there anything that we can kind of address? So we've got this picture of an iceberg, and actually the self-harm may just be the top of the iceberg. It's something that's kind of visible, that you can see or that you can talk about, but actually there may be lots more going on for that young person underneath. So based on what we just talked about, it may be that they've experienced relationship issues at school. Maybe someone's bullying them, or they've had received some nasty comments online. It may be that they're kind of starting to experience a lot of panic or low self-esteem. So we really want to look at those issues and have a think about, is there anything we can do to help address them? So I guess on a practical note, if someone, for example, has had peer difficulties or bullying, that may be one thing that we kind of really look to address and see if there's any way of kind of problem solving that. Or if there's any kind of safer ways to cope with the difficulties that they are experiencing. So any of those difficulties that they have going on in their life. So I guess what we're saying within this is, although we want to talk about the self-harm and we'll think about later strategies specifically around supporting self-harm, we don't want to miss all the other stuff that's going on, and we really do need to focus on that as well, and what we can do to support some of those other issues or difficulties. So we've got a few ideas of functions of self-harm on the next slide, but before we go on to that, we just wanted to get you thinking about what functions may self-harm serve for pupils in your school. So I guess this is asking, why would people self-harm? What is kind of the function of it? What do you think it does for them? And this may just, and we don't expect you to know, this may just be you kind of guessing or hypothesizing. It may be based on conversations that you've had before and in getting to understand. So someone saying escape, yeah, it may feel like self-harm is a way to kind of escape an emotion or a situation that they're in, maybe related to, it may be a way to kind of de-stress for them potentially, a way to have control. Yeah, absolutely. Relief, may provide relief, or cry for help. Yeah, maybe their way of kind of communicating that they need some support. Brief sensory need, yeah, that's really important to kind of identify actually, and thinking about that kind of more neurodiverse population, whether there's actually a sensory function. For example, head banging sometimes can be sometimes more of a way to kind of stimulate themselves or reflect a sensory need. Finding release from exam pressure, reaction to frustration, dealing with emotion, escaping built up emotions, yet feeling a release. I guess someone's noticed some feelings that may be related to it. So confusion, lost, or scared. Absolutely. All of those reasons are kind of helpful to think about. So we've got some ideas up on the screen now of kind of functions of self-harm, and I think a lot of these have already been said in some way by you. But in terms of kind of the research and experience that people have, these are kind of the few key categories of why people may self-harm and what function it serves in terms of managing their emotions. So it may be that self-harm helps people feel more alive or real. So sometimes people can feel quite numb or not feel anything at all, and actually they're wanting that sensation, they're wanting to feel real or alive. It may be that they're doing it as a way to keep people away or make themselves unattractive. This one is considered particularly around abuse. So if someone's been had an abusive background, this may be kind of a learned way of keeping people away, for example. It may be a way to enlist help by communicating their distress. So I guess it's kind of a non-verbal way of communicating distress. And this may be more used by those individuals that can't quite express their emotions as much. So that may be in some younger students who actually don't quite understand their emotions and can't express them, and they may do by kind of hurting themselves. Or maybe those people with special educational needs, such as autism, for example, where it's more difficult to communicate distress or understand their emotions. As a coping technique for overwhelming difficult emotions, relieving emotional tension, which I know someone definitely said, so it can kind of feel like a bit of a relief for some people. It may be a way to redirect intense anger. So, for example, if they feel angry at someone else, it may be a way to kind of redirect it onto themselves so that they don't hurt anyone else. Some people actually say it's that their coping mechanism to prevent suicide, that by using self-harm, it stops them doing anything that would end their life. Or it may be a way to kind of take control of the situation. If someone feels quite hopeless and out of control, it's one thing that they can do that's in their control, or attempt to get others to change their behaviour in some way. And it may be that it serves a number of functions at the same time. So it's not to say that it just serves one function, but each individual's relationship with self-harm is complex. And I guess it's also important to hold in mind that although that we may be able to hypothesize what function it's serving for someone, they may not necessarily know it themselves. It's not necessarily kind of a conscious thing for them. Some people will say straight away, you know, I do this to make myself feel more alive, for example, and they'll know straight away what the function is. But some people kind of struggle. They say they use it because they feel like it helps, but they don't really know why. But these are some ideas to hold in mind. So we're going to start moving on to think about responding to self-harm, and some kind of practical things that you can do with young people that you work with. But initially, in that moment where you find out that someone's self-harmed or they're talking to you about it, I think some of the things that are most useful to do are probably quite obvious to you. It's essentially responding to it with compassion. So we're all human beings and we all experience emotions, and just being that kind of fellow human being to that student. In that first moment, often what people need is just a bit of space of someone to listen to them and feel supported. So yeah, I'll go through some of these things, and I know that lots of people will be doing these automatically. It's just important to demonstrate how powerful just being compassionate to them can be. So just listening and being curious. And it's okay to ask direct questions about self-harm as well. Obviously, we kind of do it in a gentle and compassionate manner. But it's good not to shy away from some of those questions and actually show them it's okay that we can talk about this. There can be a stigma around self-harm. And so if we're quite reserved or shy about talking about it, that kind of models to the young person that maybe it's something I'm not allowed to talk about. So absolutely kind of be gentle, be compassionate, but it's okay to kind of ask some direct questions as well. Try not to interrupt when they're talking through it or be judgmental. As I said, there is a lot of stigma attached to self-harm, and often students will really worry about what people are going to say, how their parents or teachers or someone's going to react. So they're kind of looking out for those judgments straight away. So just being really careful in the language we use, and moving away from kind of using shoulds or musts or anything like that in our language. And I guess just validating those emotions and the difficulties that are underlying that self-harm. So as I said, self-harm is essentially someone that's quite distressed. So helping explore those emotions and validate. So saying, oh, I can see how that must be a really difficult emotion for you to be feeling. I'm so sorry that you feel like that. So kind of, yeah, sitting with those emotions a little bit. And what we really want to do and support the young person with is coming alongside of them. So we know it's not so helpful when a young person feels like they're being told off in some way, or being told exactly what they need to do, but actually someone that's kind of sitting alongside of them and saying, oh, I want to help you with this and support you. So this is kind of the first thing to think about, is just providing that direct kind of support, compassion, that listening ear, and also just letting them know that you want to support them, and then start to ask how you may do that. So to begin with, it's just listening before kind of going on to those kind of practical ideas of how you can support them. And actually, you know, when people have talked about self-harm, they will often say, you know, that person's first reaction has been quite crucial to whether they've told anyone else. So I would say one of the most important things is just to be that kind of compassionate listening individual. And as I said, it may be that you start the conversation like that, but then you kind of say, yeah, I really want to support you further, or I really want to ask you some more questions about this. So we've got a few more questions just to help gather the information. And before you even kind of read these or you start to think about them, just to bear in mind that you won't necessarily ask all these questions at once. And I guess you have to time it right. So if that person is currently quite distressed, you won't kind of want to be asking them lots of questions because they may be in that emotional mind state and not be able to think or reason. So I guess these questions, it's thinking about what's the right timing, what's kind of a calm enough place that I can ask them this. But these questions do allow us to build more information and help us understand why they may be self-harming, what are some of those underlying issues, and also get a bit of a sense of what the risk is in terms of for your own minds of thinking, where does this need to go next? So we've got a few different questions to consider, which covers things like what exactly are they doing to hurt themselves? Because so we want to really avoid kind of making assumptions about what they're doing or why they're doing it. So just being curious, kind of what are they using? How often? What's the impact? For example, have they ever needed to go to the doctors or hospital for a self-harm injury? Has it ever been infected or anything like that? So thinking about how badly they were hurt, anything they do to look after themselves when they have hurt themselves, trying to get a sense of when it started, what are possible triggers, what are the things that make it more likely they'll self-harm, what are the things that make it less likely they'll self-harm. One of the really key questions when thinking about what's going to support them is, do they have any other ways to cope with their distress other than self-harm? So when they're distressed but they haven't used self-harm, what is it that they're doing to help themselves? Because that's what we really want to build on. And you also may be thinking about their support network. So who does know about the self-harm? For example, are parents aware? How do other people react? And to get a sense of kind of the function for them and whether it's helpful, kind of what are their positive things about hurting themselves, what would they say those are, and what are the negative things about hurting themselves. And I guess that may kind of kickstart their thinking around actually, does this strategy always work in the long term, or what are the kind of limitations or drawbacks of using this? So thinking about the short term and long term risks as well. Now, as I said, there's a lot of questions. You're probably not going to ask all of them. It would depend on your role, how well you know the student. So these questions aren't here to kind of make you feel overwhelmed by all the different things you may ask. I guess they're just ideas about some of the things that may be helpful to find out a little bit more on, just so that we can be really thoughtful in what we do next in terms of managing that risk and how we help them get support. So you may just want to kind of look at this a little bit more and think about what are some of those questions you routinely ask, what are ones that maybe you could think about asking a bit more, what would be helpful for you or relevant within your role or capacity at school. I guess the other thing, just thinking through some of these, and we've got different age ranges, is how we may ask these things. So some of these would be a bit more geared to an older child, like a teenager. With a younger child, we may just have to change our language a bit, make it a little bit more simple, and potentially trying to kind of ask questions that are a little bit more closed if it's easier, so that they can just say yes or no. And of course, there'll be some people that really struggle to answer questions and just say, I don't know, I don't know. And that's okay, you know, if they really don't know or finding it hard to answer. We don't kind of want to push them or put pressure on them if they're not quite comfortable. It's just kind of, I guess, making sense of what you think in that moment you're able to kind of get out of them and what you're not. So we've just got another Slido, and then I think Kelsey's going to take over for the rest. So what kind of things do young people find helpful to reduce their urge to self-harm or reduce distress? So this kind of in your experience of when you've talked to young people, what have they said to you that they find helpful in reducing that urge to self-harm or reducing that kind of underlying distress? So
Because I
some,
guess thanks, Hope. Sorry, I was going to say for the second half, we're going to be thinking now more about yeah, what can we do to support them? So I guess the first half is about kind of understanding what underlies self-harm, kind of how can we explore that with young people? And the second half is thinking about, okay, well, how can we get them that support they need? How can we draw on their own strengths and their own ways of coping? Um, so I can see various things coming up here. So stuff about walking, yeah, exercise is a great one. Yeah, lots of different ways we can do that. Thinking about sort of drawing and writing. So maybe they've got creative strengths, ways to escape, perhaps in different ways other than self-harm. Having someone to talk to, I think, yeah, support, isn't it? It doesn't matter who that person is. It could be a person at school, it could be a parent, a carer, another adult somewhere, but that can often be really useful for young people that are self-harming. Um, Thinking about safe alternative based on underlying cause. Yeah, so we're going to talk a little bit about the kind of thinking about the underlying cause and how we can support young people to find different ways of coping. Yeah, so squeezing toys to release frustration. Yeah, ripping paper, that kind of thing. An app. Yeah, so we're going to talk a little bit at the end regarding some resources, something called the Calm Harm app, which you may have heard of. Um, and Lego as well. Yeah, so different interests that young people have. And the top comment there about hairband to ping on wrist. I'm going to come back to that actually because some of the guidance has changed on that. So I think that's a really good thing to share with you guys because it's quite a new thing that's come out as well. And ice is actually related to that too. So we can talk a bit about those things in a second. So we're going to move on to thinking about something called a self-soothe box, which might be something that a lot of you have heard of before. So essentially, a self-soothe box is exactly what it says on the tin. So it's a container, it's a box, it's an area in a room or in a bag, where essentially young people put things that they find soothing and calming for them. And actually, many young people who self-harm find this a really useful thing. It can be helpful for lots of different things, to feel calmer, to feel less anxious, less worried. And essentially, it's about having different things all in one place that that young person then can find easy access to. And this can actually help young people to then develop ways that they can sort of manage those big emotions that may underpin self-harm. So we're just going to play the video. Hopefully it works.
I'm just thinking because of time, maybe to skip the video.
Okay, I'll
I
explain
think
it though.
you've done
Yeah.
signs with a fairly good explanation. But
Perfect.
the video is available on YouTube through Young Minds. We'll send resources at the end.
Yeah.
But yeah, it's a video that anyone can freely access.
And this is actually a really nice video to share with young people as well, because it's by young people for young people. So they're talking about the different things that might be in their self-soothe box. So what we kind of say is it's really good if we can think about the senses when we're developing these or supporting young people to develop them. And they can have them at home, or it can be, taking items with them into school as well in their backpack. So yeah, things that they can touch, things that feel nice, fidget toys, soft things that they can smell, like essential oils on a cloth, for example, or candles if they're at home, listening to certain music, or some people kind of write out lyrics that really resonate with them and help them. Yeah, as well as kind of positive affirmations or reminding themselves to do an activity that helps, like walking, like the Lego, like we talked about before, and also things that remind them of happy times, so photographs and things like that. So really nice one, and as Hope says, we'll share that with you after the workshop. So, thinking about the supporting of use of coping strategies. So kind of coming back to those earlier points around the use of ice and sort of pinging arm with an elastic band, which I know are things that were often recommended. But now the position has changed somewhat on those things. So NICE, which is the National Institute of Care and Health Excellence, which is what we have to kind of follow in the NHS, kind of states that there's actually a lack of evidence that those things help, and actually don't not recommend, but they don't give any recommendations about the use of kind of what they're calling safer self-harm. So if there are things such as ice or elastic bands which are still kind of causing some kind of harm, they kind of don't offer recommendations around those things. But what they do talk about is kind of building on young people's strengths, ways that they already cope, and kind of thinking, I guess, creatively with that young person if they're struggling to think of things. So we know that kind of the self-soothing box are really great when a person is struggling, but we know sometimes that urge to self-harm does increase. So then that young person might need something a bit more focused to help them. So we know things like distraction, as we talked about, and that can be all different types of things. But then also things like joining a certain group or a certain sports club can be a really nice way to kind of distract, but also give them additional things that they find useful. Because we know that kind of putting off the urge to self-harm can actually decrease the urge. And that's why things like the Calm Harm app, which we'll share at the end, can be really useful resources because they come up with lots of different ideas around how to do that. We also know that reducing the accessibility of objects used for self-harm, and they can be different things such as pencil sharpeners, and things like that, may help to kind of delay that impulse to self-harm. But I suppose what we kind of say to schools, and we know that often lots of schools and education settings have a kind of very black and white take on this, around safety and kind of the need to remove any items from young people, which we totally understand and kind of respect. But I suppose we kind of think about the need to balance that with the respect for the young person's autonomy. And I suppose, again, we might be thinking about the young person's age here, because if it's a younger person, of course, that's different to kind of if it's maybe a 15 or 16-year-old. So what we kind of say is if those items need to be removed, actually try and include the student in in that decision making and explain the rationale for it. Because sometimes if those things are just taken away, that young person can then feel really unsafe in the school setting. So yeah, it's just one thing just to hold in mind, when you're following those policies and things. So thinking about more on the sort of development of coping strategies. So as someone else highlighted in the Slido, finding new ways of coping are most effective when we think about what underlies that self-harm. So again, it comes back to one size doesn't fit all. And sometimes, suggesting these things might not fit for that young person. And it's working alongside them, what we know about them, and also the people that kind of are with them at home, that love them and care for them. Sort of how can we draw those different people in to think about different ways that young person can cope other than kind of self-harming. So these are just some examples. So thinking about distraction, so finding a different method of distraction for that young person. Being able to communicate. So maybe that young person is using self-harm as a way to kind of elicit that care that they need to get to be able to communicate their distress. So think with them about how could they communicate that in a different way. And it might be different things work with different people in their lives. But that, can be a really useful way that they then don't need to use the self-harm in order to communicate. And similarly, thinking about kind of eliciting care. So of course we know that when a young person has self-harmed, and their body needs an attention as a result, kind of that medical intervention, then of course we need to show care and concern for that young person. But when it says kind of thinking about spending more time with the young person before they self-harm, think with them about, what could they be trying to communicate through that self-harm. But we need to also kind of recognize that maybe when we're noticing a bit of a pattern when actually kind of supporting that young person with their wounds, actually, is part of their kind of eliciting care, and actually that might be reinforcing the self-harm unintentionally. So think about maybe that young person can care for their wounds themselves in that situation, and then think about, what are you giving them in that moment when we're caring for the wounds, and when can we do that at a different time? How can we facilitate that in a different way? Just so it doesn't kind of inadvertently encourage that, unintentionally, really. We talked about these other ideas about letting emotion escape. So thinking like screaming, writing up and ripping out paper, someone kind of said, all useful ways to kind of let that emotion escape as well. And obviously some other ideas there on the slide. And I'm sure you guys have loads of other things that you're kind of thinking of as I was reading those out. So thinking about self-harm, wound hygiene, and aftercare. Now, of course, this is something you guys are aware of, but we just wanted to mention some basic guidance because obviously it's important to think about if a young person is self-harming. But always follow your school policies and procedures around that, and seek kind of NHS support and advice if you're unsure. But we know with things like bleeding, applying pressure, and then cleaning under a running tap is important, and using kind of a sterile dressing. With burns, cool with water for 10 to 30 minutes, and then cover with cling film. And of course, if we're seeing maybe an old self-harm wound that's infected, we need to seek medical help. And of course, if we're concerned about any injury, or a child is taking, tablets and overdose, or is reporting to have done that, any substances, then we need to seek that urgent medical help, of course. Um, okay. So we're now going to move on to think a bit more about safety planning, and I'm sure this is something that you guys are already aware of. So just to say, this is kind of our definition, but we kind of see safety planning as a way of kind of helping children and young people achieve and maintain their safety. And this is through really clear plans which are developed with them. That's really important, and with people that are important to them and kind of care for them. So parents and carers, maybe other people, and then it's something that is shared and used. These plans, as I said, it's really important for them to be developed in collaboration with the young person and with other people. And again, depending on the young person's age, depends on how much we may include parents and carers in this. But definitely, if that young person is consenting to it and everything, it's really important to include parents, even for ones that are much older. So a safety plan doesn't just think about when things are really difficult and when there's a crisis. Of course, it does cover those things and thinks about how can we kind of achieve that immediate safety. But it also thinks about, when things are going well, what does that look like? What helps? So thinking about more general coping and well-being, as well as plans for support and coping if things start to deteriorate. So kind of identifying what that might look like for that young person, what their triggers might be, and then what could help them. So just a Slido question. Do you use safety planning with young people who self-harm or have suicidal thoughts? It's just useful to know if it's something that you guys are using already, aware of. Um, yes. Okay. Not sure. Okay, so we're going to go through an example in just a second. So maybe that will help to kind of, yeah, think about what they are. And, there's different forms of them as well. We're just going to show one example, but just thinking about, what's going on for that young person, what's working well for them, also what their triggers are, what can help when things start to deteriorate, as well as what to do in kind of emergency or crisis situation. That's effectively a safety plan. Okay, so we'll move on. So this is just, as I said, one example, and this is Papyrus safety plan, which is freely available online. Again, we'll share the link to that. But it can be quite a nice one to use with young people. And it's really important that we think about different areas of their life. So what kind of helps them to feel good both at school and at home? What do they like to do? What's their kind of favorite thing? So it might be favorite food, it might be favorite lessons, for example, and who or what makes them laugh. So it's kind of thinking about that kind of general well-being, that general safety to start with. And then we move on to think about, what could make them feel bad. So what might those triggers be? What situations, make them feel worse? It could be certain lessons, certain people, for example, certain things outside of school. And what does it feel like to them? How do they describe that emotion? And has something maybe happened to make them feel that way? So it's just really, I guess, using some of those questions that Hope talked about earlier to really kind of bring out what is it for that young person? What could be underlying some of these behaviors? And I guess this is a tool to help us think about that as well. So then we think about how could that young person keep themselves safe right now? And it's thinking about what could they do and what could others do, because that's really important. So who could they speak to? And again, that might be someone outside of the home, inside of the home, as well as kind of in school as well. So really naming those people, and anyone named on a safety plan should know about the safety plan. So it's again speaking to that young person, bringing in those other people. Again, are there things around them that makes them feel unsafe? And that might be the sharps that I talked about earlier. If a young person is cutting themselves, it might be other things. We don't know. And could they be somewhere or do something that helps them to feel safer? And then if they can't stay safe, who will they tell? Again, it's about those trusting adults. Who can they help? Who can they go to? And if they need help, who can they ring? Again, that might be another adult, it could be a friend, or a helpline. Again, we're going to share some resources around that you can then share with those young people. Also, things like the text messaging services as well can be really good. So things like Shout. And then reminding themselves of what's important to them, what they love, and that's a really important thing to have on a safety plan because a young person will have a copy of this. And sometimes just having that reminder, similarly to their kind of self-soothing box, it just helps them kind of ground themselves and think about, what does life mean to them? What do they enjoy? Which can also help when we're thinking about self-harm urges. So hopefully that kind of gives a bit of a sense of what a safety plan might look like. Please do ask any questions in the Q&A though if you do have any questions on that. Okay.
And I was just thinking, for the younger people, so primary school age and particularly the young ones, it may be that the safety plan is done a little bit more with the parents in terms of how
Mhm.
they can kind of keep the house safe and how they seek support and what numbers they're going to use. There may be some involvement the young person can have in kind of a simple way, whereas for an older child or adolescence, it may be kind of very much led by them, and parents kind of may have a copy of this, but it will be more kind of led by them. So yeah, I guess the age will make a difference to how much involvement and kind of how much is their ideas or not.
Absolutely. And this is just one document. You can use pictures. Yeah, you can draw it out with, do what works with for that young person and that family. Young people that you're working with, that you work with really well. So just kind of draw on those things. You don't have to do it in that exact way as long as it's kind of covering some of those main issues. That's the kind of key bit really. Um, so we're kind of coming to the end now. We're thinking about support networks, and that we're kind of mindful that we've covered a lot today. That it's been a whistle-stop tour. It's only been an hour, and obviously we could talk about this topic for hours and hours. But I guess we wanted to give you some information just to kind of help you to kind of understand self-harm more, think about, what you can do within that education setting to help them. But this is kind of a reminder that we don't expect you to do everything. Um, you're one kind of system within that young person's kind of broader system. And we know that kind of risk management is kind of a constant dynamic process. So identifying those risks, helping young people to manage those risks, is a huge team process. So we know that everyone who is working with that young person, seeing that young person has kind of a role to play in this, and you're kind of one piece of the puzzle. Um, so we need to think then about sort of other pieces in that puzzle. So as Hope kind of said, thinking about parents and carers, especially for those younger children, but I think in all cases, it's really important to bring them in, think about safety within the home, and also when they're with their young person outside of the home as well. It's really important to do with them, thinking about other people that might be involved. So kind of school nurses, might be a mental health service if the young person is getting support there, social care, for example, as well as other people like the GP, that young people will be under. So think about how can we kind of all come in and support each other, because it's really important to have that kind of shared agreement between professionals and other agencies. And really just the importance of us being honest, because as we kind of said, self-harm and the kind of things that underpin it can be really emotive for all of us. So just be honest if actually supporting a young person feels too difficult right now. It's rarely helpful to be the young person's kind of only source of support. And they kind of may benefit from developing relationships with other people, whether that be other people within the school context or indeed in their kind of wider system. And really, as Hope said, it kind of accept the fact that we can't, completely get rid of this risk. And we can't always be there when the young person is self-harming or has urges to. What we can do is think about, what can I do to support this young person right now? And am I the best person for different reasons? So hopefully, yeah, it's just a bit of a reminder of that. And linking to that, really just thinking about your own support network. So we know, as I said, this is a really emotive topic. And you may have personal experience yourself, or you have your own young people in your own life, where this is kind of bringing up difficult things for you. So again, it's just really important for all of us who work with children and young people in whatever capacity that we think about our own emotional health and well-being, and think about your own support network. So again, things like GP, adult wellbeing services if we're struggling with our mental health, or staff support services, but also more informal things. So like our colleagues, our family and friends, and things that we like to do. So in the same way we think about, what maintains that positive wellbeing for our young people, what maintains it for ourselves as well? What can we do to kind of support ourselves, especially when we're supporting young people with such tricky things? Okay, so finally we're coming to resources. So this is thinking about resources for you guys as school staff. So the first is more of kind of a general toolkit around supporting education settings around self-harm. So it's more of a general one. And there's also a specific one actually for those of you in Suffolk around a management toolkit, as well as secondary schools in Norfolk. There's a self-harm policy we wanted to share with you. Um, and then thinking about key resources for students, there's the Calm Harm app that we've talked a bit about. So this is an NHS recommended one for young people that self-harm, and there's lots of different features to it, which lots of young people find useful. It's completely free to download and to use. There's a self-help guide there as well, again, for those older students who may want to kind of read about things and think about self-help. That's a nice guide to share. As well as thinking about services. So we've got school nurses, there's Self Harm UK, which is a free online group course for 14 to 19-year-olds, which I believe that young people and families can self-refer to. So again, it's for those older ones. And then there's Cooth, which is 11 to 25-year-olds, which is a free online counselling support offer. And then as well, you've got your more crisis service, which is NHS 111 option 2, which you can see there on the screen, as well as things like Samaritans and Childline. So useful for young people to know and to kind of form part of their safety planning as well, if they feel that they can use those helplines. But really important for parents and carers to be aware of the NHS crisis support as well. Okay, and then thinking about resources we can share with parents and carers, as we've said, it's really important to bring them in with this. So we've got the Young Minds Parent Helpline. There's some parent guides as well around self-harm, and then again, sharing that with parents about how to get support in a crisis for both Suffolk and Norfolk. So yeah, please do share those links with your families depending on where you are. And then other useful contacts, so things like the mix, and then yeah, other sort of various things as well. I won't go into all of them because you can see them on the screen there, but useful numbers